to this computer and okay. I'm just checking the chat to see if there's anything in the chat and no emails either. So I will start sharing and we will jump into today's topic, which is countertransference and use of self in counseling. Before we start, though, I have a couple of announcements. Um, uh, the training department let me know that there was some conflict between meetings that you have in some of your units. So starting on December 3rd, which is the first Tuesday in December, these trainings are going to change to 3 in the afternoon, 3 to 4:30 in the afternoon. So hopefully that will not conflict with anybody else's meetings in your department. Again, that starts December 3rd. Your coordinators have been given that information and the link with the new time. Also, next week, our last training of November before your Thanksgiving holiday, for those of you who are interns, we're going to work on genograms. And what I'd like you to do is bring paper and pencil and an eraser to next Tuesday's meeting, and colored pencils or pens or markers if you have them, because what we'll be doing is creating a genogram during the training. Your own family genogram is a way to learn how to use genograms. So let me look at the chat again, and everything looks good. All right. So as you know, in these trainings, it is helpful that you have arrive on time, cameras turned on, et cetera, et cetera. You know the BHRS Zoom training policies. I don't care if you eat or drink, because I know for some of you, this might be your only lunch break.
That's
So today
crazy.
we're going
It's your
to
only break to eat.
and somebody needs to mute themselves. I'm sorry, when I'm in presentation mode, I don't have access to all of the other uh, abilities. Okay, so talking about countertransference and use of self. So these are things that are helpful to talk about, but they're really hard to quantify. When I do train at the university, a lot of people ask me, well, what is the definition of use of self? Well, it's our personal attributes and our personality and the way we engage in relationships with other people that affects the therapist-client relationship or the clinician-consumer relationship. Now, looking at, excuse me, looking at the factors, um, looking at the factors related to what works for clients and what helps clients be most successful. The most important factor is what the client brings to the room, but the second most important factor that accounts for 30% of change is the relationship between the consumer and the provider. And so having a successful, attached, and rich relationship really helps the client achieve their goals. The other issue that we're going to talk about is countertransference, and this is how our own internal feelings and thoughts about the consumer affect the consumer-client relationship. So, in golly, maybe 20 years ago and older, you were taught to be a blank slate. You're supposed to be something called tabula rasa, which just means blank page or blank slate. You're supposed to check your biases at the door, check your feelings at the door, and engage with the consumer from that perspective. And that was very much a psychodynamic or psychoanalytic psychotherapy perspective, which is what everybody was trained in prior to about 20, 30 years ago. But I think more recent trainings and more recent research has shown that, we're all humans. And as human beings, we have biases, we have thoughts and feelings, we have opinions, we have ways that we relate to each other. And it's normal for us to have feelings one way or another about a consumer, or it's important for us to use who we are as individuals in a way that's helpful for client growth and achieving client goals. So that's been some changes that I think are very helpful in the therapeutic world. So to review use of self, it's a sum of who you are, how you're aware of yourself, where your social location is, who you are from a demographic perspective, your skill set, access to power, how you advocate for people, your personal practice style. It makes you unique from everybody else who does this. when I train people on using a particular therapeutic modality, I say, whether it's CBT or ACT or DBT or solution focused or strengths based, that modality has to make sense to you in the language that you speak. You have to think it's useful. So this is part of your use of self. So who you are as an individual affects what modalities you choose to learn, what modalities you choose to do you do really well, and then how you interact with the consumer. So it's really important to consider these factors as a clinician. And countertransference occurs when a therapist transfers emotions to a person in therapy or projects our emotions onto the other person. Um, I think countertransference is good. I view countertransference as information, and it gives us information about the client or it gives us information about us, or sometimes both. When we engage in any kind of relationship with another person, whether it's a consumer or a family member or a friend, we share feelings back and forth. Some of you have heard of the concept of mirror neurons, where when somebody in the room is feeling a certain way, we tend to start feeling that way too. And it's a complex interplay of our neurology and biology. So I think countertransference is important to talk about. It's information and it's a really useful tool for you to use in counseling. So I've got a 7-minute video. I'm going to pop the link in the chat. I'd like you to watch this video. And it's from a gentleman who is an occupational therapist, but he does a really good job of explaining what use of self is in a professional relationship. So I am going to stop sharing so I can mute myself. Here we go. I'm going to mute myself for a few minutes. So watch this video for 7 minutes. Okay, we'll give another minute for folks to come back from the video. Okay. I'm going to put a question in the chat that I'd like you to answer in the chat, just kind of a waterfall or a popcorn in the chat. What makes you unique as a counselor? My example is my sense of humor. I don't show it at first because it tends to veer to the sarcastic, and I have to be very careful that I know the person I'm talking to before I kind of share a little bit more of my sense of humor. And those of you who know me know that I call myself a smartass, and I struggle sometimes with that. But that makes me unique as a counselor, and I really appreciate clients' senses of humor. So put in the chat what makes you unique as a counselor. It can be your sense of humor, the languages you speak, your past experience. What is it that helps you use who you are to connect with clients? We'll take a minute to get folks to pop that in there. Empathy, listening skills, patience, excellent qualities. What makes you you, and how do you use that in counseling with individuals and families that you work with? Knowledge of pop culture, boy, that is an active area of education for me. I'm not as young as I used to be, and I got to know what's the movie, what's an anime, what's in gaming, what's on TV. Takes a lot of education about that. Love of nature, being bilingual, being able to speak Spanglish with Mexican American clients. I grew up in a Cuban culture in Miami, so I understand Spanglish. Um, Absolutely. What are some of the other qualities that's unique to you? I will again share the video link. I'm getting to my cheat sheet here. A couple of people came in after I posted the video. Honesty, boy, yeah, that's a huge thing. Ability to listen to clients and make them feel heard. Honesty and transparency is so important. I really value that in my own work and in the when I go to see providers. Um, just went to a doctor's appointment. I really appreciate a doctor who's going to answer my questions and just give me straight up answers. She's not going to tell me what to do, but she's going to tell me you can do this or you can do that. Right? I appreciate that immensely. So yeah, and I love this video because this gentleman has so much energy and he really did a good job of describing what makes him unique in his delivery of occupational therapy services. So let me go back to my cheat sheet. We're going to break into small groups now and talk about some other aspects that the gentleman presented in the video. How can your use of self and your personality, and let me change that slide. How can your use of self and your personality, or how can you use yourself and your personality to build rapport through the following activities that this gentleman spoke about in the video: advocating, collaborating, empathizing, encouraging, instructing, and problem solving. So I'm going to break you into groups of 4 or 5, and I'm going to ask you to discuss this. I put it in the chat. We're going to have breakout rooms for about 12 minutes. I'm going to do 15 minutes. actually, so that you get a time to talk about each of these. So just, you're not going to report out to the larger group, but just take your time to discuss these different aspects of working with consumers and building rapport and how you use yourself to do that. So let me create the breakout rooms, and I'm going to open all the rooms, and please accept your invitation when it pops up on your screen.
I mean, we answered part of the question. Oh, hold on.
Okay. Um, for anybody, did any of these stand out for you? You can share with your voice or share in the chat. What makes you and your personality to build, what makes your person, I sometimes I say things backwards. How do you use yourself and your personality to build rapport through any of these following activities? What stood out for anybody? And you speak as an individual and not for your group necessarily.
One of the things that I kind of talked about with my group was because I was sharing how, I like to, when I'm speaking with clients or whatever, like just kind of really let them know that I'm listening.
Mm.
I think I try to make sure that I'm, fully kind of engaged in the conversation and like really let them know like they're being heard. Um, so, trying to um, talk to them and let them know like kind of everything that I'm understanding that is what they're trying to say,
Mhm.
especially if they're trying to, advocate for themselves. Like I want to make sure that, I'm really hearing them and hearing like what they're trying to express. Um, so pretty much that's kind of what I spoke about during this our meeting in the group.
Great,
Mm-hmm.
great. Thank you. Thank you. Other folks, how do you use yourself and your personality to engage in any of these activities? Some other examples might include, for advocating, if you're a very good speaker and you um, are not afraid to speak up for people in the community, advocating can certainly be one of the activities that is unique to your personality and your ability to do that. The last speaker just really spoke about empathizing and encouraging people using your active listening skills to empathize and encourage people. Sometimes problem solving is you can see things in a pretty logical, ordered way. And so maybe that's unique to you, and problem solving is a good technique for you to use. So all of these things come together to really be helpful for our clients. And so let's look at some other activities that require use of self. Just what we talked about, active listening. We talked earlier about honesty and transparency. Client-centered practice, knowing who you are helps you be authentic and reliable to the client. Authenticity, obviously, being culturally curious requires use of self, consciously using knowledge, skills, and values, and becoming aware of your biases. All of these things require use of self in order to build rapport with a client and to engage a client in services. So let's talk about also what's not use of self, because sometimes, particularly early in our careers, we think that helping the client see how we're like the client or the same as the client or that we get the client builds rapport. And that can be very tricky. So oversharing personal details and stories really depends on your setting. In certain settings, it's expected that you're going to share some personal details because it tends to be a consumer driven aspect of the profession. So, for example, in substance use, it's frequently staffed with people who are in recovery. So sometimes in substance use, there's an expectation that you might talk about that. Working in with military personnel or veterans, the expectation that you acknowledge whether you're a veteran or a civilian. Um, some other settings, working in gang reform, Again, frequently stats with people who were previously in gangs, so it might be some expectation about that. Same for working in prison reform or working with people after they've been released from prison. Working in the LGBTQ community or gender clinics, sometimes it's expected that you're going to be upfront. So working with specific populations, sometimes you do need to disclose a little bit about yourself. And working within particular cultural groups, sometimes it's expected that if you're a member of that cultural group, you're going to share a little bit of your narrative, sometimes who you're related to, or when your family came to the US, if it's an immigrant group, something like that. So just be aware of that. Otherwise, you need to ask yourself, why am I sharing this information? If you're sharing personal information, how will it help the client? It's usually not a good idea to share information about how you overcame a situation. Sometimes that can set up the client to feel, oh, I'll never be as good as my counselor was at overcoming this situation. So you got to be careful when you share that kind of information. Um, Before using personal details to build rapport, first use other techniques to build rapport. There's tons of them. Active listening, using clients' language, paraphrasing and summarizing, focusing on client goals, validating feelings, being culturally curious, etc. So shoot for those first before you share personal details. And even sometimes when I have a personal story that I want to share that I think would be useful for a client that's personal to me, I'll just say, one time I heard somebody tell this story, blah, 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 whatever the story is, so that I think it can be useful because I don't want to personalize it to me. Um, the other thing you have to be careful of, and it's not really an example of use of self, is telling a client you know how they feel, you understand what they're going through, or you get their culture, even if it's the same as yours. We are all different and we all have different experiences, and this will frequently alienate a client. They might be thinking, you have no idea what I've experienced, even if you've experienced something similar to me. And sometimes that interferes with the relationship rather than building rapport. So instead of saying, I know how you feel, or I understand what you're going through, or I get you, say, things like, boy, I hear you, or ask an open ended question. Gosh, what was that like for you? Instead of validating them by saying you understand it, validate them by validating their feelings and their experience and asking them more open ended questions about their experience. So, in the chat, we've already done this. What are some aspects of who you are that you can use to build rapport with clients? Think about how you can expand that. Um, we got some single answers in the beginning of the session today when we were using the chat. But think of the more ways that you can use who you are, your personality, your personal attributes, your cultural context to build rapport with clients in a way that maintains the focus on the client. So we're going to shift to countertransference and how do you use it in counseling? And again, I have another video that I'm going to put in the chat. This is about a 10-minute video, and it is a clinician discussing her perspective of countertransference. And she goes through a little bit of the information I talked about earlier. So let me get this in the chat and watch this video on your own. And we are going to have some conversation about that, both in the large group and in the small group. So I'm going to mute myself, and I'll see you back in 10 minutes. Okay, we'll give folks a minute to come back from the video. Okay, so I agree with this clinician. I think countertransference is information. And I see it as giving us two pieces of information. It's either information about the client or it's information about me. So am I projecting my own issues onto the client? Is the question to ask, or do others respond to the client this way? So a couple of brief examples. I went to a yoga class one time. First time I'd used this yoga instructor. I got, 5 minutes into the yoga session, I was so irritated with her. I couldn't focus on any kind of yoga. She was telling me to close one nostril and breathe through my nose and lion's breath. And I just wanted to do warrior pose. And like 10, 15 minutes later, I'm still really angry with this instructor. I'd never met her, I'd never interacted with her. And I had to sit and ask myself, why am I so angry? And why am I so angry about this person? And I realized she reminded me of somebody in my personal life that I was having a lot of conflict with and a lot of anger with. And then I could relax and join in the session because I realized it wasn't about her at all. That was an experience or an example of just projecting my own stuff onto the other person. In the past couple of years, I've had a couple of clients I really struggled to like. I want to like all my clients. I think that that helps me with my unconditional positive regard. And I really struggled to have that for these two clients. And so in supervision, I worked out with my supervisor, is this me projecting onto them, or is this the way anybody would respond to the client? And since most of the people in the clinic I work in had had those clients, they affirmed to me was like, yeah, it's really hard to have unconditional positive regard for these clients because of their personality and their clinical issues. So those are just two really brief examples. So it's really important to talk about countertransference and supervision. It is absolutely normal to experience feelings about clients. And we frequently talk about the negative feelings, but you also can have countertransference around positive feelings for a client. So be curious about it. Be curious about it in all your interactions in the workplace. And I put down here discuss countertransference when it's strong, troubling, perplexing, etc. I think you should always discuss countertransference in supervision. That's the best place to talk about it because then you can talk about what to do about it. So let me give you two very specific clinical countertransference examples. These are from my clientele. So one was a cake decorator. She's a very, very, very smart woman. She wanted to go back to college and get her career going and something else, but she was working as a decorator, very petite, very small, very pretty, very smart. And my personal response to her was, wow, I wanted to take her home, cook her food, feed her up, and tell her how to fix her life, right? And so I had this positive countertransference that was very, very strong. And so at the time I was in private practice and I didn't have supervision anymore, but I met with some colleagues once a month to what we would call discuss cases, doing case review. And I wanted to figure out how to share this information with her because I wanted to check it out. Is this how everybody responds to her? So I described what countertransference was. She could understand it. And I checked in with her about my feelings. And she did affirm that, like, yeah, like everybody she dated wanted to take care of her. And she was tired of that kind of dynamic in her relationships with men. And so we were able to then open up that area based on my countertransference with her, similar to being the countertransference anybody would have with her, and that she was already experiencing with people in her life. Another example of countertransference is I know I have this countertransference with people who look like my mom. My mom's been deceased for about, 15, 20 years now. And she had a very specific look that's kind of common in the Central Valley because my mom was part Cuban. And so she had black hair and brown eyes and a round face and a nice, curvy, very sweet lady that I had a lot of conflict with because sometimes we do have conflicts with our moms. And so it's an emotionally complicated relationship even though now I'm mostly left with warm feelings and a longing for my mom, but I always talk about this in clinical supervision or with my supervisor in training and consulting because I don't want to project my feelings about my mom onto folks who look like my mom. So those are two clinical countertransference examples. So I'm going to put you in small groups again and give you about 10 or 12 minutes to talk about this. I want you to think of a person or a client or just somebody you know about whom you've had strong, strong feelings. Discuss with your small group and determine if you were projecting your own issues onto the client or if this is how other people respond or how anybody would respond to this client or this person. Then I want you to pick one example to report out to the larger group and remember your breakout room number. So again, I'm going to copy this and put it in the chat and then put you in small groups. I'm hoping I'm going to get you into the same small groups you were in before, so you at least have some uh, history with your group already. So there's yeah, look at the one that's the chat that's associated with my initials. The one below it looks funny. So let me get you into your breakout rooms and give you about 10 or 12 minutes to have this conversation. So you don't need an example for everybody, you just need one example for your group. Okay. So I'm just going to call on groups to report out. Group one, what is your example? Group one? Okay, I'm going to move on to group two. What was your example? Please just speak up, whoever you decided in group two was going to report out.
I don't know. I didn't take down the number group I was in. Do you happen to have the?
I don't, once I close it, I don't have it, but go ahead and report out.
Okay, well, I'll just share for my group.
Thank
I
you.
know for me last year I was working in an elementary school. And for one of my clients, I had to make a CPS report. And the parents ended up finding out that I was the person who made the CPS report. And they were not happy about it. And so I had the parent call me and essentially yell at me. And they at that point didn't want their client, they didn't want their student to receive any further services. Um, and I had already started building rapport with the client. Um, and they were like, they had a lot of like ACEs. They were experiencing like a lot of trauma. Um, and so I definitely wanted to keep seeing them as a client, but at that point, because parents didn't want them to receive any services, I essentially, had to stop, and that was definitely hard for me. And I had to recognize that I had my feelings involved. But yeah, that's kind of what I talked about.
Absolutely. And so, what were the feelings that you were having for that child or that child client?
I was definitely hurt. I was definitely hurt because I knew that they would greatly benefit from receiving services, whether it was from me or somebody else. Um,
Okay.
so yeah,
And do you think these were feelings that were unique to you, or do you think other people in your situation would have felt similarly?
I don't know because I did mention to the principal that the client was no longer going to be receiving services, and
Mhm.
the principal was nonchalant about it, even though they had also known about the trauma that the client was experiencing. So I want to say maybe it was just me that was feeling that type of way, but I'm not sure.
Okay, good. It's still important to explore those feelings. So thank you, Carmen. I appreciate you speaking up.
Yeah,
Other
no problem.
people that have an example from their group.
I think in our group, most of us had a similar story where we couldn't actually pinpoint like specifics, but we kind of all overall shared a relative that
Mhm.
someone that we worked with that kind of reminded us of a relative in like physical features, just in personality, something of that gist. And then what we noticed is that we were either putting too much energy in the case where it ended up in feeling like we were getting burnt out, or that it wasn't a client and clinical relationship. It was more like more personal. And then, or us feeling like we were overprotective of or overwhelming. So it just kind of made us feel those. And then we noticed that wasn't normal. So we acknowledged that the best thing we all were able to kind of do is just check in and acknowledge, like, hey, this is inappropriate. Like some people went to supervision, some people just kind of recognized it and was able to manage it. So that was our group.
Thank you, Noelle. I appreciate that. Yeah, if you feel like you're working harder than the client is, or you're feeling overwhelmed, or any strong emotion, or feeling like you really want to help somebody, it's really important to talk about it in supervision, either individual or group supervision. So those are great examples, Noelle. Thank you. Anybody else have a breakout report from their group. Okay, so I just really want to reiterate that we're all unique. Who we are is part of what we bring to the worker-client interaction. And it greatly affects how we build rapport, and the strength of the relationship with the client also affects client outcomes. And so it's really important for us to figure out and to explore these issues as they come up. Countertransference is one of the ways that we have to talk about this. And so it's a good way to talk about the feelings that get brought up and your attitudes about your consumers, excuse me, so that you can be more helpful to them. So I want to address something that came up in the chat early on about next week. So genograms, bring pencil, paper, eraser, colored pencil, or pens. Yes, we're going to talk about how to draw out marriage, divorce, domestic partnerships, and fosters, adoptions, issues with immigration, um, other kinds of relationships. Who's in a family? Because this is families in America now. The so-called nuclear family, I don't think exists anymore. It certainly is the outlier in my experience, just in my personal family as well as my professional life. So yes, we are going to address all of that, and there are some newer ways in which to draw symbols on a genogram so that you can make all that clear. So always this week, think of one thing you can do this week to increase your awareness of use of self and countertransference and be specific as possible. Write that down for yourself. Keep a running list of these goals in your own notes on your phone or in your tablets, and check back on them periodically to see how you're doing or what new insights you have about these goals. So y'all have a good week. Enjoy the cooler weather, and I will see you next week. Take care.